Welcome to today's webinar, Injury Facts, Data You Can Count On. During today's presentation, attendees will be in a listen-only mode. To ensure that you can see all of the content for the event, please maximize your event window. To also maximize your slide view, click on the Scale button located in the upper right area of the window above the slides so that it shows 100%. If during the program you would like to submit a question, please use the chat pod located in the lower left corner of your screen. Type your question in the box at the bottom and click Send. If you have technical difficulties, you may contact the Help Desk at 1-877-297-2901. I'll now turn it over to Ken Kolash. Please go ahead.
Thank you, Monica. I'm, as Monica said, Ken Kolash. I manage the statistics group here at the National Safety Council, and I am thrilled to be here with you today. Thank you for calling in. We do this presentation every year for National Safety Month to highlight the latest data we have collected for injury facts, data you can count on. If you were with us last year, we were able to announce our new website. Last year we were transitioning from the traditional paper book that we had since 1921, and we were in the process last year of transitioning to a free online interactive resource. So a lot of what I was talking about last year was not quite real. It is all real now. I am happy to announce that we have a fully functioning website with all the sections filled out. The information, if you were used to the book, is now on the website, and it's in general much richer, fuller data than we were able to present in 200 pages. We have an unlimited amount of space now and a lot more interactive ways to display the data. So I'm very excited. So obviously I'll be talking about the website, but really the reason for this presentation is to highlight the latest preventable injury and fatality trends in the United States. The overall trends, home and community, motor vehicle, and work. As I do that, I will be sharing with you the tips and tricks of how to get the most out of the website. So before I get really deep into the data, I really need to show you a few ways to get around and navigate the website. If you click in injuryfacts.nsc.org, and I'm getting a few messages that people are not hearing the audio. Monica is...
I will address that. Thank you.
All right, should I pause for a moment or should I keep going?
I'm going to go ahead and give the dial-in information if people are having issues. Thank you.
All right. Well, hopefully most of you can hear me. A few people did not receive the dial-in information, but that's being sent to them right now. I'm getting a note here that the dial-in is not working, so I'm afraid we're going to be losing people. So I'm going to proceed with just how to navigate around the website. That way people are not going to miss important information about the data itself. So if you go to injuryfacts.nsc.org, you'll see this landing page, and you could navigate using this top navigation, or we can scroll down and to the call to action buttons, and we can select any of these call to actions. And if we were on the live site, we would be able to see a brief summary of each of these sections. We're going to click on the all injury section here. And I do want to highlight that for technical reasons, we were not able to do a live web demonstration. So I've done many screen grabs to help simulate the experience you would get on the website. So when you go to the all injury section, the first thing you will see is this side navigation. If we expand the side navigation, we will see topics minute by minute, odds of dying, and we're going to click on deaths by month. And when we click on deaths by month, we land on its topic page. Before talking about trends by deaths by month, I want to let you know that you have two options here. You are automatically sent to a data brief page, and that's just what it says. It's just a quick overview of the topic using infographics and videos and simple charts. Or you have the option of clicking on the Data Details tab, which we'll do next, which gives you access to interactive data. But for now, let's stick to the Data Brief page. And right here is an infographic, which is pretty typical of the types of information you find on Data Briefs. If we were on the live website, when you scroll over the data line, you would actually pop up the actual data so you could actually see the numbers. Often with infographics, there isn't a lot of actual data being delivered, but this is injury facts, and injury facts is all about the numbers. So when you scroll over the lines, you will actually see the actual data. And what this shows, obviously, with the natural heat and cold, natural cold deaths peak in the winter months, natural heat deaths peak in the summer. When we talk about fire deaths, they actually peak in the winter months associated with heating of homes. And now it's summer. We're almost in July, which is the peak month for drowning deaths in the United States. So that is a typical data brief page. And if we scroll back up, remember, we can go to the Data Details tab, which is what we're going to do now. And there is copy descriptive information on the Data Details with the Data Details page. And I see here that people are able to hear us now. So sorry so much for the technical problems. I'm glad you could hear us, and we're just starting to get into talking about the deep data if you did not hear the first part of the webinar. But this is one of our interactive charts looking at deaths by month, and because it's interactive, we can do a couple different things. We can change the year. We can scroll through multiple years of data, and we can also look at specific causes. This next slide shows the trend of drowning trend by individual month. And we see here there were 662 deaths July 2017. So we're just about to start the peak month for drowning deaths. All right, now so that's our demonstration of how to get around the website. Let's really get into the data. But one more housekeeping sort of tip. I'm going to be going through a lot of information relatively quickly, and I hope you want to go back to the website and explore on your own pace. And to facilitate that, I've taken screen grabs of where each page is located on the website. So for this is compared to preventable injury page. It's obviously in injury facts. It's in the all injury section. It's under the intentional death section, and the page is called compared to preventable. So whenever I go over a topic that you're interested in and you want to go back to, jot that breadcrumb down, and you'll be able to go back to the specific page I'm demonstrating. All right, now with that, let's talk about the data. Then this is a image I'd like to start off with because I think it provides a lot of context to what is happening in the United States. About 250,000 people in 2017 died from injuries. And 2017, by the way, is the latest official data available from the Centers for Disease Control. So of that 250,000, or 243,039 deaths, 70% were preventable or accidental. The National Safety Council tends to use the term preventable rather than accidental because every one of these deaths is in fact preventable. So 169,936 people died from preventable injuries in 2017. 28% died of intentional injuries. Of those, the vast majority were suicides or self-inflicted injuries. 47,173 people died from suicides, and then another 19,510 died from assaults or homicides. And that surprises many people. When we watch the news every night or read the newspaper, we generally hear about assaults and homicides. But in fact, there's far more suicides occurring in the United States than homicides. We rarely hear about the suicides unless it is a celebrity who's fortunately the victim. So I think this gives a really good context. This website and this presentation is going to focus primarily on the 70% of preventable or accidental injuries and deaths, although we do have additional information on injury facts looking at the intentional injuries when appropriate. So let's dive into preventable injuries and death. It is the number one leading cause of death for people from 1 to 13 years of age and from 16 to 45 years of age. And it's the third leading cause of death for all ages. And in the span of this 1 hour webinar, typically about 19 people die on an average hour in the United States from a preventable injury. So it's not a infrequent event. It's occurring even as we're talking. As I discussed, is the third leading cause of death. As recently as 2012, it was actually the fifth leading cause of death, and it's been gradually moving up to the third. Although it's not the third leading cause of death for both men and women. It is and using this filter, this is an actual interactive chart on injury facts. We can select by sex, and looking at the trend for men, unintentional or preventable injury has been the leading cause of death since 2001. But for women, it is the sixth leading cause of death for women, and it has been since 2004. But again, overall, across both sexes, 169,936 people died from preventable injuries in 2017. That is third behind heart disease and cancer, well below both of those two leading causes of death, and above chronic lower respiratory disease, stroke, and Alzheimer's disease. When we look at where these deaths and injuries are occurring, the vast majority of preventable deaths and injuries occur at home, over 50% for both deaths and injuries. When we talk about deaths, about 23% occur from motor vehicle crashes, and another 22% occur in public places. When we talk about injuries, 28% of those injuries occur in public places, and then it's fairly well split between 9% motor vehicle injuries and 9% work injuries. So proportionately, there's far more work-related injuries than there are work-related fatalities in the United States. When we're looking at overall trends, and this is looking at age-adjusted death rates, which is the best way to look at very long trends. Age-adjusted death rates take into account both the changing number of population in the United States from year to year, but also takes into account and controls for the changing age range in the United States. In general, our population is aging now compared to how it was several decades ago. We're able to keep all of that constant so you have a better understanding of the true trend. And the first takeaway is we're much safer today as a society than we were in 1910. In 1910, there was 103 deaths per 100,000 population. We're less than half that now at 49 deaths per 100,000 population. But unfortunately, we are going in the wrong direction. Since 1992, and that's the year we had our record low population rate of 34 per 100,000 population, we have been going up. In fact, the death rate has gone up 44% since 1992. So the obvious question is why? What is driving these changes right now? And this is one of another interactive chart. And it starts off feeling a little overwhelming, but we can change that. We can change the view to meet our purposes. So I'm going to be adjusting this year filter, and we're going to zoom in on just from 1992 to 2017. And what we see in that view is poisoning deaths. Unintentional or preventable poisoning deaths have gone up over 900%. Fall deaths have gone up over 187%. And although motor vehicle continues to be a leading cause of preventable death in the United States and is a topic we're going to be spending quite a bit of time on today, it is not what is driving the current upward trend. In fact, motor vehicle deaths have gone down 2% since 1992. Let's look at a different historical perspective to further clarify what is happening today in the United States. This is going back to 1999. We can't go back all the way to 92 because of coding changes. This is the number of deaths per individual year of life. So it's a number of deaths per year. And what we see here is the leading causes of death. And this yellow line right here, that's motor vehicle. And what we see fairly clearly that older teens, young adults, there was a large sort of mountain of deaths for those young adults. We also see several other issues. For children under 1 year age, we see an increase in mechanical suffocation that often is related to unsafe sleeping environments. In the middle age group, we see an increase in poisoning. And in an older age group, we see an increase in fall deaths. Now let's skip ahead to 2017, our most recent data, and you see how the safety landscape has changed and how much more complex it is. We no longer have the one dominant issue of young adult driver safety to be concerned with. The issue of mechanical suffocation for very young children has grown. We should take some credit and be happy that we actually have driven down the number of young adult motor vehicle deaths in the United States. We have made great progress. As you will see, there's a lot more to do, and there's a lot more safety concerns with young, inexperienced drivers that we still need to address, but we have gone a long way. But unfortunately, poisonings have skyrocketed, and this is a reflection of the current drug overdose epidemic we're now struggling with as a nation, predominantly opioid overdoses. And there are more older adult fall deaths in the United States than ever. And we'll be talking about those topics more as we go through the presentation. There is one more sort of subtopic I want to talk about before we go into the individual safety topics. As I go through this presentation, the fact is that many of these stats are driven by non-Hispanic white deaths. And the reason for that is 75% of everyone who dies from a preventable injury in the United States is non-Hispanic white. So it is easy to overlook the different trends that may be occurring in our populations that may be different than what non-Hispanic whites are experiencing. So we have a resource to start exploring that. This is in the all injury section, looking at race and ethnicity. And this, again, is a little bit overwhelming, but it's interactive, and we can focus on the topics that are most important. So we're going to be looking at a few sub-trends now. The first trend we're going to look at is we're going to look at non-Hispanic or Latino whites. And what we see here is the overall death rate is 24.13 per 100,000 population. We see that the increase in the death rate really starts with the 25 to 34-year-olds and persists even through age 64. We also see a fairly long-standing steep increase in the death rate within this population. Now let's look at non-Hispanic, Black, or African Americans. We first see it's a substantially lower death rate, 19.39. We also see the peak death rate occurs later in life at age 55 to 64. And we also see that the increasing trend really started 2 years ago. But even with that rapid increase in the last 2 years, it's still a substantially lower overall death rate than we see for non-Hispanic whites. Now finally, let's look at Hispanic or Latino whites. We see well, first of all, let's look at the overall death rate. It's again even lower than the Black or African American population. The peak age is 45 to 54, but the peak starts at 25 to 34. And we also see that the trend really started accelerating about 2 years ago, just as it has for African Americans. So I do encourage you to go and look at different race and ethnicities by leading cause of death. You will see different trends, and it's really important to dive into that. Unfortunately, we don't have the time today to do that dissection for each and every topic as we go through the slide deck. And now let's look at odds of dying. Odds of dying gets a lot of attention each year when we release our new estimates, and this year has been fairly historic. For the first time ever, your odds of dying in an unintentional or accidental opioid drug overdose is greater than it is dying in a motor vehicle crash. You have a lifetime odds of dying in an opioid from an opioid overdose of 1 in 96, while your overall odds of dying in a motor vehicle crash is 1 in 103. Looking at the other sort of side of the spectrum, you have one chance in 243,765 of dying as a railway passenger. There were 17 deaths in 2017. And the majority of my work is to explore the human cost of preventable injuries and death. But there's obviously also an economic cost. And in 2017, we estimate that the cost was $100,034 billion. And that's equivalent to $8,200 per household or $3,200 per person. And these are societal costs that we all pay directly out of pocket through higher prices for goods and services and higher taxes. When we look at how those costs are incurred, the majority of those costs are actually lost in wages and productivity, followed by medical expenses and administrative expenses. So now let's transition to the home and community section. Home and community venue are deaths or injuries that occur in or around the home, occur in public places, are not work-related, and don't involve a motor vehicle. And you may wonder, why are we focusing on such sort of a specific definition of a category of where injuries occur? And it's because it's where the majority of preventable injuries and deaths occur in the United States. Of the 169,936 deaths in the United States, 75% occurred in our home and community, 127,300 deaths. For 1 out of 9 people experienced a medically consulted injury from an injury that occurred in their homes or community. And medically consulted injuries are any injury serious enough to require medical consultation. And the trend lines, as we've seen in other places, are going in the wrong direction. This is the number of deaths, and we really see a huge increase in home deaths as well as public deaths. And just as we explored with overall trends, the two primary reasons for this increase are increase in poisoning deaths, 434% increase, an increase in fall deaths, 186% increase. As we drill into those two topics a little closer, we see that there's a lot of variation by age group. This is overall home and community deaths by age group, and we see the 25 to 44-year-olds and 45 to 64-year-olds and 75 and older groups have a disproportionate number of deaths, but that changes substantially by cause of death. Looking at poisonings are overwhelmingly among 25 to 44-year-olds and 45 to 64-year-olds. When we're looking at fall deaths, we are talking predominantly regarding the 75 and older age groups. So now let's drill down into the preventable poisoning issue in the United States. And unfortunately, this is truly an historic occurrence in the United States, and we'll go into some of the data. When we are talking about poisonings impact every age group, but they impact age groups differently. When we're talking about poisoning exposures, and poisoning exposure is counted by the number of caused the poison control centers, 44% are for children under the age of 5, and 40% are for individuals older than 19, while 16% are between 5 and 19. So those are poisoning exposures. So the entire population is exposed to poisoning risks. But when we talk about more serious poisonings that result in emergency department visits, 91% of those visits are for individuals 19 years older than 19. And when we talk about deaths, over 99% of poisoning deaths occur to individuals older than 19. So when we're talking about poisoning exposures, we're really talking about an issue that impacts all of us. When we're talking about injuries or deaths, we're really talking about an adult safety issue. Looking at the overall trends, in 2017, right, in this bar, 64,795 people died from a preventable poisoning death. That is up from 12,186 in 1999, and the death rate has also increased. Let's drill down in the drug overdose issue. This is another interactive chart. As you see here, opioid drugs accounted for 43,036 of those deaths. Cocaine accounted for 13,253. And methamphetamines accounted for another 8,786. And these are not mutually exclusive categories. You can have multiple drugs involved in a death. So let's now drill into the opioid overdose issue, looking at the various drugs. When we are leading the opioid problem right now is the synthetic opioids that include fentanyl. We have 26,211 deaths followed by heroin, and then we're looking at the natural and semi-synthetic opioids after that. But this gray line here, that's showing the huge increase in the synthetic opioids that includes fentanyl in just the last few years, which is really driving the increase in opioids at this time. Now let's look at older adult falls. Here's the trend line for older adult falls. We're looking at 65 and older population. The bars are the numbers, and the line is the rate. In 2017, 31,190 people over the age of 65 died from a fall, and that is equivalent to 61 deaths per 100,000 population. And you see a huge increase since 1999. There's really two drivers behind this increase in older adult falls. One is simply there's the population of older adults continues to grow, so more people are at risk from falling at this age. But the second reason is improved surveillance. The data coding systems used to record all deaths in the United States did shift with 1999, and the new coding system does a far better job of capturing fall deaths among older individuals. An older adult fall generally is not a life-threatening event at the time. Individuals are generally slipping or tripping on the floor at home, resulting in injury, resulting in long-term medical care, and then weeks or months following the fall succumbing to secondary infection and ultimate death. Very unlike a workplace fall, falls from heights, falls from ladders or scaffolding, which tends to be a much more immediate death following the event. So now we have a way to better capture the true impact of older adult falls than we did in previous years. And a lot of this increase is because of more accurate counting. Let's look at fall trends in one other way. The top two sets are looking at non-fatal trends. The bottom two sets of bars are looking at fatal trends. The left is looking at counts, and the right is looking at rate. The first thing you should look at is when you're talking non-fatal age trends, both young children and older adults are at risk. But again, when we're talking deaths, it's generally the 75 and older population that is most at risk. And now let's transition to the motor vehicle section. Motor vehicle deaths really did not go up particularly in 2017 compared to 16. They were 40,231 deaths in 2017, nearly flat from the year before. Also, if you are a motor vehicle safety expert, this number is probably a little higher than you're used to seeing. The National Safety Council uses the estimate from the Centers for Disease Control that looks at both traffic as well as non-traffic related deaths, so it's a higher number than what the National Highway Traffic Safety Administration typically uses. It's a more complete count. They're both very valid numbers. They just are counting slightly different populations of events. So with that, let's look at overall trends. As I indicated, we really did not see an increase this last year, but what you also do see is a lot of peaks and valleys. The red line is the number of motor vehicle deaths, and you see a lot of peaks and valleys, but a general downward trend. When we look at the dotted blue line, that is the deaths per 100 million miles traveled, and we see a consistent downward trend, more or less, in that trend. So what's accounting for these peaks and valleys when it comes to motor vehicle deaths? Many of those peaks and valleys can be explained with macroeconomic conditions. The gray columns here are looking at recession periods. So you see pretty clearly that during most recession periods, the number of deaths sharply declines. When we look at the death rate also sometimes declines more than normal, not always, but sometimes. Following the recession period, the number of deaths tends to generally go up a bit, but generally not as high as their pre-recession counterparts, which is exactly what we have seen in this last recession. This is the post-recession trough. We have just gone through an increase and now have had 2 years of stable motor vehicle deaths. When we look at death rates, the death rates did actually go up just slightly from 119 in 2010 to 125 currently, but really the death rate really has not gone up as much as the number of just the death count. And now let's look at some of the safety issues that explain how these trends are occurring. Again, as I indicated, we have made some great progress in helping to protect our young drivers. But even with that, in 2017, 4,750 people died in crashes that involved at least one young driver from age 15 to 20. Also, when you're looking at the 15 to 20 age group, motor vehicle deaths are the leading cause of death. Young driver fatalities, and obviously not just young drivers are impacted by young driver safety issues. Everyone who shares the road with young drivers is impacted by young drivers. Less than half of the total number of young driver-related deaths are the young drivers themselves. And young drivers do face some unique risks. This is a really interesting research study which looked at the proportion of trips taken and when fatal crashes occurred. And looking at the 16 to 17-year-old drivers, less than 1% of their trips occur between midnight and 6 a.m., yet 13% of the fatal crashes occur at that time. Less than 10% of the crashes, trips of young drivers occur between 9 and midnight, yet those trips account for over 17% of the fatal crashes. So and this is one of the risk areas that is directly impacted by state-mandated laws to help protect young drivers. And those types of laws that help regulate the amount of driving that occurs late at night or very, very early in the morning really go a long way of helping to keep our drivers, young drivers, safe. Distracted driving is an area which we are continue to be concerned with. We actually have seen some improvement, and I'll show you some promising data. But even with that promising data, we still have around 3,166 people who died in police-reported crashes by NHTSA. And this is probably an underestimate. It's very hard to ascertain if distraction was a factor in a crash during post-crash investigations. We also, through another NHTSA program, know about 5.3% of drivers are using their cell phones at any given daylight moment. And obviously we would like that percentage to be zero because the National Safety Council doesn't believe there is any safe way to use your cell phone while driving. When we look at the number of crashes, we see that the number of distracted affected crashes has been fairly flat and perhaps is going down. In 2017, there was 401 fatal crashes involving a cell phone, and in 2,534 additional crashes that included some other distraction as reported by police. But as I said, we do see some real hope for the future. We've had 5 years in a row with observations showing that fewer drivers are using their cell phone while behind the wheel. That percentage is down to 5.3% overall, We are down at 2.9% for handheld cell phones, and we're down to 2% for visible manipulation of handheld devices. And what this means, it's texting, it's dialing. They're not; these are true observations, and they can't tell exactly what is happening on the phone. But that is really good news. What is even more promising is the fact that the youngest drivers, the 16 to 24-year-olds, we have had 2 years in a row of them using, not being observed less frequently, visibly manipulating handheld devices. And that is great news. We do have a small percentage of 70 years old and older drivers now texting and doing other stuff with their phone. Hopefully that trend does not persist. When we look at alcohol still accounts for 29% of all deaths, but we have made great progress. In the late 70s, it accounted for about 50% of all motor vehicle deaths. Now we're down to 29%. But unfortunately, still 10,874 people lost their lives in a crash involving at least one alcohol-impaired driver. Occupant protection, we continue to make progress. We have 90% overall seatbelt use in the United States, and a big part of that is the primary enforcement laws that enable law enforcement to pull drivers over for not wearing their seatbelts. In those states, 91% of people wear seatbelts. In states where primary enforcement is not mandated, we have an average of 86% seatbelt use. But still, we had 10,076 people die on our roads in 2017 who were not wearing seatbelts. Just as important is making sure our young children are properly restrained in the car. Very few young children are not restrained because obviously parents are very concerned with the safety of their children. In fact, observations showed only 2% of children under 1 were not restrained. Yet 25% of under 1-year-old deaths are unrestrained. Only 5% of children 1 to 3 were observed unrestrained, yet unrestrained deaths account for 20% of the deaths in this age group. And it continues. For 4 to 7-year-olds, 11% are observed unrestrained, but that unrestrained accounts for 37% of deaths. From 8 to 12, 14% of children are observed unrestrained, and unrestrained children account for 50% of all motor vehicle deaths in that age group. We also have one other special page I would like to highlight. This is looking at the number of children who die after being left in hot cars, and this slide is actually slightly out of date. We're up to 13 deaths this year in 2019. We update this page on a real-time basis as new data comes in throughout the year. So it's one of those pages, if you're interested in this topic, you could come back to, and it's likely different, unfortunately this time of year. It grows on a weekly, if not daily basis. And speeding. Speeding continues to be a major issue with 9,717 deaths. And it's one of those issues that we need to continue to focus on for young drivers. As you see that young drivers, both particularly males, experience a much higher proportion of fatal crashes who were speeding, and across the board for all age groups, men are more likely to be speeding who are involved in a fatal crash than are women. And with motorcycles, motorcycle deaths are relatively flat for 2017, but they still experience a disproportionate amount of risk. They represent 3% of registered vehicles and less than 1% of vehicle miles traveled, but they still represent about 14% of the fatalities. When we look at When we look at the number of lives saved, since 2002, helmets have helped save 25,567 lives, and that is great news. And I am running a little bit short on time, but let's finish up with pedestrians. 7,500 pedestrians died on our roads in 2017. The majority of those deaths occur in dark conditions, and those dark conditions are particularly an issue on weekends. The number of pedestrian deaths occurring in the dark does rise on Friday, Saturday, and Sunday. And let's move on to workplace deaths. The total number of workplace deaths were actually down 1% since 2016, but the unintentional or preventable workplace deaths were actually up slightly, about 0.5%. The total number of workplace deaths in 2017 were 5,147. And when we look at the trend line, since 1992, the total number of workplace deaths in blue and in black, the unintentional number of workplace deaths have both been increasing. And this is primarily due to the recovery. The number of workplace deaths did go down during the recession. When we look at where the most fatalities occur by industry, we see construction, transportation, agriculture, but this doesn't take into account that different industries have different numbers of employees working. So when we look at the hourly based rate that helps adjust for the size of the industry, we see that agriculture, transportation, warehousing, and mining are currently the most at-risk workers. When we look at how workers are hurt, not killed, the leading cause is overexertion and bodily reaction, followed by contact with objects and equipment, and then falls, slips, and trips. When we look at workplace deaths, 40% of those deaths are transportation related, followed by falls, slips, and trips, and then violence, which would be homicide and primarily homicide, and secondly suicide. When we look at non-fatal trends, the trend continues to improve. We are down to an overall rate of 2.9 per 100 employees in 2017, and the DART rate, which is cases with days away from work, or restriction, or transferred, is down to 1.7. When we look at non-fatal rates by industry, state and local government, education, health services, manufacturing have the most non-fatal injuries. When we look at the rate to help account for the different size in industries, we have agriculture, forestry, fishing, state and local government, and transportation. I want to highlight a few really useful pages in Injury Facts. The first is the Industry Incident and Rate Profile tool. You can select your industry to look at, and right now we have manufacturing. And just on one simple slide, you can see the overall trend for either non-fatal injuries or fatal injuries. You can look at the distribution by sex, distribution by age, look at the top events and the top occupations, and if you scroll down, there's even more information. Overall, workplace injuries and fatalities cost the United States $161.5 billion. That's equivalent to over $1,000 per worker and averaged over $1 million per fatal injury. I also want to highlight we have a large selection of safety topics highlighted right now. This is the profile for falls to the same level, and you can look at non-fatal injuries, non-fatal rates, or fatalities. And we have all of the leading causes of fatal work injuries and non-fatal injuries that you can explore on your own. And I really do encourage you to go back to explore. And with that, I just really want to provide a quick summary. Hopefully now you see all of the information that is available at your fingertips by visiting injuryfacts.nsc.org. But beyond that, I hope you all walk away with a better understanding of the overall trends that are facing our nation, uh, and the successes we've had as well as the challenges we currently face. Looking comparing ourselves to 1992, and again, 1992 is when we experienced the lowest preventable injury death rate in U.S. history. So comparing ourselves to that best moment in time, workplace death rate has improved a further 38%. When we look at motor vehicle deaths or highway death rate, the death rate has gone down 32%. So we've made great progress in both motor vehicle and workplace. But then if you look at the death rate of the home and community, it's up 131%. This is being driven, again, by opioid overdoses as well as older adult falls. And when we take these three trend lines and average them together, overall, preventable death rate has gone up 54% since '92. And this is something we need to continue to address. We need to keep strong our focus on what's already working, workplace and motor vehicle, and we need to double down on helping to further prevent opioid overdoses as well as older adult falls. And with that, that is my presentation. Please, we do have a few minutes, I guess around 8 minutes, and I'm going to go scroll through the question and answers, and I'll try to answer a few of the questions. And the first question from Paul, can we copy and paste information from the website into PowerPoint without copyright violations? Absolutely. I do ask you to cite Injury Facts as a source, but we really want the information in Injury Facts used. Also, there are above each of the charts on the website, there's a way to download the underlying data. So yes, please use this information and share this information, and then please cite the information so others can learn about the valuable resource. A question from Tiffany. Are the poisoning rates increasing due to more accurate reporting, or is this the attribute to some other factors? Undoubtedly, the reporting of poisoning deaths is becoming more accurate, but that does not account for the majority of the increase we are seeing. It is being driven primarily, in the last 2 years, it's been driven primarily by the influx of illicitly manufactured fentanyl. But this has been an ongoing issue that really started with prescription opioids. A question from Sharon. Thank you very much, Ken. A lot of work has gone into providing that in a very, well, that was just a thank you. I didn't mean to, yep, and use the questions and comments. If you have any other questions, I'd be happy to answer them. And I do not see a question in from, oh, Beth, does the poison include alcohol poison? Oh, thank you. Great question, Beth. Does poisoning include alcohol poisoning? Yes, it does. It is relatively a small fraction of overall poisoning, and you could see that if you go to the home and community section and then look at poisoning and then go to the poisoning detail tab. Alcohol is singled out, and you could see the alcohol poisoning trends. It is not included in the overall drug overdose trends. All right, let's see if there's any other question. And I don't see any other questions at this time. And let's just leave it open. And here's from Naomi. This is nope. I think. Oh, here's one. Is the increase in pedestrian deaths directly related to distracted walking? There is. We don't have enough research on distracted walking. It is probably playing a role. We actually did do, there was a really great study around 4 or 5 years ago that looked at distracted walking related falls and actually, or injuries, and a lot of those distracted walking injuries actually were occurring in one's home, not just on the road. So we really need to be careful and cognizant of our surroundings, regardless of where we're walking. And obviously, when crossing the street, we really do have to make sure we're focused on the task at hand. And another great question from Stuart, anything in regards to how fatigue impacts the number of incidents? We do have a fatigue topic page for workplace, and it's under safety topics that you can explore. We don't have a great amount of research or data, fatigue and motor vehicle, if that's what you're asking for. We probably will develop a page going forward. These last 2 years of building out injury facts has really been focused on replicating what was available in the book. Now that we're sort of reaching the end of that process, we're going to be adding new topics that we did not have room for in the book. Fatigue on the road will be one of those. So stay tuned. I can't give you a timeline of when that's going to occur, but really, and also on the bottom of each injury facts page, if you have a suggestion for a topic or a question, there's a contact us button. Fill out the survey form and ask your question. I actually am the one who monitors those requests. So you will be interacting with an expert who can really answer your questions. And let's see.
One has come in. Have you any preliminary data for 2018 showing a decrease in OD rate?
I don't have detail on that. We will be looking at CDC, the Centers for Disease Control, does have an early sort of reporting estimate project out there, and I honestly have not looked at that lately. But that is a great question. And if you Google CDC opioid deaths, you might be able to find something. I'm sorry, I don't want to speak without knowing the exact answer.
And another question reads, when do you anticipate the 2018 stats will be added?
Great question. Most of the federal data starts to become public sometime in November. They tend to release data right before the holidays. They're probably trying to finish it up for them, but it means I get really busy right around the holidays. So often motor vehicle or overall death data becomes available in November or December. So as soon as we analyze the data, and we will start updating the website as quickly as possible. So you will definitely start seeing new 2018 data starting in January, and then all of the pages will be updated within a month or so after that. So the way Injury Facts is going to live and breathe from November to February is going to be updating season, and the other times of the year we'll be building new pages or improving existing pages. We hope to always build and improve injury facts throughout the year for years to come.
Another question has come in. Is it possible to use the industry data for benchmarking an individual company's injury rate?
Absolutely. You really, as long as you are collecting data based on the OSHA record-keeping guidelines, which I'm sure you are, you can calculate per 100 full-time equivalent employees. And you could look at your specific industries, and there is more specific industry data available on our website that is beyond just the major industry sectors. You can really use your industry code and really compare specifically to your industry.
Have you seen an uptake in vehicle-related injuries with marijuana use or workplace injuries with marijuana use?
That is a quickly evolving area of research. There is some preliminary data. Some Insurance Institute for Highway Safety did look at the number of motor vehicle crashes, I believe in Colorado, compared to neighboring states, and they did see an increase. We really do need to continue and do more and more research in that area.
And with overextension being the number one on the days away from an injury, what is your opinion on preventative measures?
And that's overexertion injuries. So overexertion injuries are often lifting and twisting type injuries. They involve material handling type occupations, so they're especially high in the warehousing and transportation sectors. They're also particularly high in the healthcare occupations as well. And it's really, it's twofold. We really need to do as good of a job as possible of engineering out that manual lifting, and particularly lifting and twisting type activities. This also includes repetitive motion injuries that can impact all of us, including office workers with working on keyboard. So another way is training and making sure your employees recognize the hazards and any discomfort they may be feeling before it becomes a medical issue, so they can work with your safety professionals to engineer out or mitigate the hazard that may be causing the discomfort.
And the last question reads, if we need assistance interpreting the data, is there anyone we can contact?
You can, and the best way to do this is actually not through a phone call, but is actually at the bottom of each web page in Injury Facts. There's a Contact Us, and that is not going to go into some black hole that will never be seen again. I actually monitor the Contact Us on a real-time basis. I get a ping on my email, and I do my best to answer the technical questions. So I really encourage that. It sort of puts you in a queue so we don't lose your question.
Okay, thank you so much.
Well, thank you, everyone. I look forward to this presentation every year. It gives me an opportunity to share with you all the work we do throughout the year. I hope you find it helpful, and more importantly, I hope you find injuryfacts.nsc.org helpful in helping you stay safe and keep the employees you are responsible for safe.
Okay, well, thank you so much. Thank you for joining us for this webinar. We appreciate your attention and participation in today's event. To assist in future webinars, we will be sending out a short survey regarding this webinar, and we certainly appreciate. Thank you, and to end this call, simply hang up the phone.